Today, we are marking a milestone in the fight against TB in Kenya as we launch two important policy documents to guide our efforts in ending TB in the country. TB remains a global and national public health concern. Globally, 104 million people are infected with TB, of which nearly 1.5 million die each year. In Kenya, TB is the 5th leading cause of death. In 2019, we reported and treated 86,504 cases of TB, of which approximately 10% are children. Drug-resistant TB cases have been on the rise, with 688 such cases in the country as of 2019. Despite TB diagnosis and treatment being offered free of charge in public and faith-based facilities, not all that are infected with TB are reached and therefore do not receive the required care. This is a challenge for our TB program, and we are continuously working towards reaching all those that are infected with TB so that they can get the right care and the proper care. One of the policy documents that we are launching today speaks to the rollout of a regimen for treatment of multiple drug resistance TB that is devoid of injections, in line with the World Health Organization's call to eliminate injectables from multiple drug-resistant TB treatment regimen to improve treatment outcomes. The second policy document addresses preventive treatment of latent TB infection offered to individuals who are at risk of developing active TB. Preventive treatment has proven to be an effective intervention to curtail development of active TB disease. These two policy documents on TB are key to the ministry's strategic goal of ridding the country of TB by 2030 as envisaged in Vision 2030 and the Sustainable Development Goals.
As we all know, tuberculosis is a preventable and treatable lung disease that continues to ravage many vulnerable populations, households and communities in this country and across Africa. Nearly 2.5 million people contract tuberculosis in sub-Saharan Africa last year, and more than 660,000 died of this disease. In Kenya, the National Strategic Plan to Control Tuberculosis was launched 1 year ago with the aim of curing at least 597,000 cases of tuberculosis by 2023. Since then, Kenya has made progress in combating this disease and has adopted a robust, patient-centered strategy such as finding missing people with tuberculosis through active case finding initiatives, embracing new diagnostic tools, treatment regimens, and direct patient support. Now, with these new policies, by adopting a shorter, patient-friendly tuberculosis preventive treatment and prioritizing its scale-up across the country, Kenya has dramatically changed the TB prevention situation among people living with HIV, contacts of TB patients, and other high-risk populations. This new approach will ensure that latent tuberculosis infections are treated and protected from developing active disease. In addition, this adoption of an all-oral treatment for multi-drug resistance that replaces a painful and toxic injection that patients had to endure previously, it makes it easier for patients to tolerate and to adhere to this treatment. The adoption of both strategies follow the most recent recommendation of WHO, and through these strategies, the Ministry of Health expands its effective and essential patient-centered quality care of tuberculosis patients particularly during this COVID-19 pandemic. Let me also say, as the COVID-19 outbreak escalates in Kenya, it is important that the essential health services, such as the treatment of tuberculosis, immunization, maternal and child health, and all those services are maintained. Even while we have to do everything we can to slow this racing epidemic of COVID, let us not leave behind the treatment of the diseases that cause long-standing and ongoing suffering.
On my part, Dr. Aman, we as CHAI, in support of this effort, in support of these policy guidelines, have today donated 43,000 treatments for latent TB. And out of that 43,000 treatments donation, 4,000 of those are already in country and have been distributed to various health facilities. So it is not just the launch of the document or the policies, it's also the action that follows that also matters. So CHAI is glad to partner with you in making those policies a reality on the ground where the policies are much, much needed. And of course to the benefit of the patients who are waiting for these initiatives to be rolled out. In addition to that, Dr. Aman, we have also committed to working very hard to lower the cost of these treatments. Right now for the latent TB treatment, it's about 4,500 shillings per treatment. And I'm committing here to you that I'm working towards bringing that down to just about 1,500 shillings per treatment. And we'll be back again with you to apprise you of that development as it happens. We remain committed even on the drug-resistant TB that we've seen cases come up. And again, there is work that is ongoing there to make the treatment even easier than it is today.
Thank you.